Hi guys, it's me again. So one thing I wanted to try to talk about are the complications you can have after weight loss surgery. Now, these complications are really dependent on the kind of procedure that you had done. And you have the early complications and the later complications. Most of the complications that we do find are the ones that are later. And I mean, the term complications is very loose in the sense that they are not complications in the sense that there's a problem with the surgery or in the sense that the surgery didn't go well. No, they're just long-term effects that could happen after surgery. Like with any other surgery you do, any other treatment you do, whether it's medications or even surgery, it's still the same thing. Long-term, you can have some issues with the treatment. And weight loss surgery is no different. When you're thinking about the effects, the long-term effects of the operation, for one particular operation, which is the sleeve gastrectomy or the gastric sleeve, which most people call it by, you do find that you might have acid reflux or heartburn, or you might find that you burp a lot. These are all possible long-term effects that you can have after the gastric sleeve. Now, this is treated mostly by medications, but there are options surgically that help to treat that more permanently. Now, there's so many things that could cause heartburn after the gastric sleeve, and that's one of the reasons why I do tell folks that whenever you have surgery for weight loss and you're having any complications, it's always good to see another bariatric surgeon so that they can actually evaluate you to see what else could be causing the heartburn. Now, another complication that can happen in any of the procedures is abdominal pain. Again, there are very many different reasons for abdominal pain after weight loss surgery. So it's always best to have a bariatric surgeon sit down, talk to you and explain to you what the possible causes could be, and to try to evaluate and investigate, find out what the problems are and actually solve the problems. One major thing that we do have after weight loss surgery is weight regain. Now, for no reason do you think that it's your fault for you regaining the weight. There are many different factors that come into play for weight regain after weight loss surgery. In these situations, again, it's a good idea to sit down and talk with a bariatric surgeon to know what your options are. Over here at CGA Weight Loss, I do my best to sit down to talk with you about your surgery, make a plan of action, and we go step by step, trying to evaluate all the possible causes for any of the effects you're having and to look at the possible treatments. Not every single effect needs to be treated with surgery, but we look at the risks and benefits of each one to see what's best for you. Again, what I do is help you to make the right decisions for your health. My goal is to make you happy, healthy, and successful.